Okay, so you've used T-Sheets before. This is T-Sheets on steroids. A couple things about it. When you're on the home screen, I would stick with either room view or all patients. Personally, I like all patients and just say all patients, all rooms. That's going to show you everybody in the ER. My patients, anybody you've signed up for will be there. My completes, this is that stack of charts that you haven't finished that you're going to leave on the side of the desk. History log is everybody who's been seen in the ED, and work list is kind of a combination of my patients and my incompletes. But this typically is going to work fine. You're basically working your way down this right-hand side over here. I'm going to also show you this. If I click on this icon, I call it the accordion, I can shrink this up a little bit. If I click on this icon, I can see the reg paint. So you kind of want this view so you can see who's coming into the ED. All right. So we're going to do a real quick, easy little run through these patients. I've got their names. I've got their chief complaints. So if I want to decide who I'm going to see next, I can either look at the chief complaint. I can look at the triage level. If it's a 1, it's somebody that's pretty sick. If it's a 5, not so much. And I can also look at the length of stay if they've been here longer than the other person. If it's a tie. This shows who the nurse is, shows who the physician is. Physician is assigned when you choose a template or if you were to double click and assign somebody. This shows orders, which we're going to do in a little bit. This shows that all the orders have been completed. This shows that there are new lab orders, new x-ray orders that have not been addressed. If there was a red N here, it would mean the nurse has not addressed those orders. These are orders that have been unaddressed for a long period of time. These are different flags that may be assigned to a patient. This could be, in this case, this patient's a flight risk, or you could say it's a cardiac alert, COVID, frequent flyer, etc., etc. Okay, does not become part of the chart. It's just kind of a heads up to each other. Clinical data, the CD column. If they change something, there'll be a little icon. So I'd look at clinical data, which is this over here, and you'll be able to see meds, allergies, past medical history, etc. Vital signs just means there are abnormal vital signs entered. That will go away if you click on that. And processes will show you results. No results have been crossed yet, but if you were to right-click on that column and click on diagnostic results, you would then see the DIG levels, the Dilantin levels, etc., etc. Okay? All right, comment section, you can type in whatever you want. This is not part of the chart. It is visible on the airport view and everybody's desktop, so be careful. And then disposition is what you select, and we're going to walk through that process. So basically, this is your home screen, and these are your tabs on the side. Right here, if you're going to change a template, you would click on this. Hopefully, you're not going to have to. So I'm going to use what patient? Let's go with this patient right here, this Magnolia White with abdominal pain. She's a ESI level 5. I've got a nurse on it. I've got some labs that the nurse has already ordered. So I'm going to highlight my patient. And I'm going to click on history. Now this brings up the template picker that you should be used to. Basically, trauma's on the left, head to toe. I've got PD stuff down here, multiple trauma. Medicine side, again, medicine head to toe, and then neurocritical care over here. This is a little bit different because I also have pediatric templates I can click on, and I also have a couple other, and that is basically major trauma, sickle, and flu viral symptoms. Okay, so let's go back to general. Let's go with abdominal pain. So look at his belly. There's your template. Check that. Click OK. All right, this is going to open the encounter time. So typically, this is saying you're seeing the patient at 13:32. If you're good with that, click OK. If you saw him 10 minutes earlier, then change that time by using the little down arrows. But I'm going to say I'm OK with that. So click OK. It's going to open up the template. This is what you're used to. The big difference here is where in the past we had to write down here, we write up the margins and do all that stuff. You now have an unlimited amount of space here. So let's start with the time. Very important because they're tracking times. Click on the clock. Upon arrival is not a time. click on the clock and just say now, or you can say 5, 10, 15, 25, or I could type in 11 minutes ago and it will auto-calculate, but I'm just going to say now. And you don't have to hunt for the X, just click over and say they arrived by private vehicle, patient's historian. Chief complaints, belly pain, started last night, it's still present. It's described as sharp and stabbing, it's not burning. It's not burning or migrating. So again, the way we're marking this is the same way we did it on the paper template. So circle is a yes, backslash is a no. Let's say the pain is located in the right lower quadrant. I can say that they've had nausea, but no vomiting. They've had a loss of appetite, no diarrhea, okay? If I want to elaborate on any of these, I can click this line and say, you know what, that's been mild. Or every one of these I can free text in, okay? So this is one of the real benefits to me going from paper to this. You just have so much more room to do stuff, okay? This is HPI. If this guy came in and said, I've got belly pain, oh, by the way, my hemorrhoids are swollen, I've had a rash for a year, you can still address this stuff by going into an expanded HPI. So I could do his hemorrhoid stuff here, and I could do his rash, etc. But we're not going to go there. The whole goal of this is if you select the right template, that all your stuff that you need is top level. So try to stay out of the donuts, okay? This is review systems. I typically will try to get 4 elements in my HPI, so onset, severity, modifying factors, etc. I'll try to get 4 or 5 things in review systems, particularly if they are complaint specific. So is there constipation? No. Any black stools? No. Is there any blood in their stools? No. Any urinary problems? No. Any fever? Any chills? No. So I'm going to mark those. So if you think about it, this is neuro and EENT. So, you know, I'm going to say there's no headache, there's no sore throat, blurred vision. So basically right now I've got 1, 2, 3, 4, 5 review systems. The other thing you can always do, as always, is say everything's normal except is marked. So I might say I've got some kind of semi-review systems that are included in my HPI. But again, mark what you want to do. Nobody says you have to do it all. Past medical history. This part is kind of cool because I don't have to really mess with this anymore. I don't have to say see nurse's notes. I can actually pull them in. So what I would suggest is click on either problem list or meds allergies, either one. I would go with meds allergies. Click on that. And you're going to see what the nurse has documented. In this case, they haven't documented anything. But had they documented stuff, you would simply look at the meds allergies. We're just going to say none. We're going to add that. We're going to go to allergies and say NKDA. But again, hopefully they would have done this. So basically, if they put this stuff in, you just look at the meds and allergies. You go to problems. And there will be a list of whatever they have there. We're going to say no known problems. There is also, at this point, if this is populated, you would simply click on nurse list. This is important. So look at the meds allergies, look at the problems, click on nurse list, and it's going to pull that in. We're going to look at the surgical history. The same thing. If there was anything populated there, you would review it and click on nurse list. And then click OK. What you're doing when you click on that nurse list is you're pulling all that data into your chart. So unfortunately on this little guy we didn't have that, but typically that's all you would do. Go to meds allergies, review it, go to problems, review, nurse list, surgeries, nurse list, and pull it in. Smoking, up to you. Basically they're either a smoker or they've never smoked. If they quit, you still have to say smoker, and you have to say former and when they quit. Okay, so we're going to make it easy and say they're never smoked.
You don't look like Amy.
I know, I'm not. Okay, so this is the history page. All right, now on the exam page, doesn't hurt to say nurse's notes reviewed. You can look at vital signs if you want to. If there are vital signs in, there's a way to pull those in if you click on it. However, I'm on Amy's computer and I don't know how to move this out of the way. Physical exam works just like it does on the paper template, okay? They're alert, they're oriented, they're in pain, eyes are normal, ears normal, neck's normal, etc. belly. So again, circle it if it's normal. It's soft, but they've got tenderness. It's in this area right here. It's moderate. It's in the right lower quadrant. He's got guarding and rebound. And click out. Okay. So just exactly the same as on the paper T-sheet. Circle it if it's normal. If it's not, leave it blank. Move right. Explain why. Okay. Other thing you can do is you can also / pertinent negatives, just like you did on your paper templates. So not going to spend a lot of time here other than to say there are always gimmies on the physical exam, things like their skin. Is it warm and dry? You see that? Yes. There's no rashes? Yes. Are they oriented? Yes. No respiratory distress. So some of these are just kind of gimmies, but go ahead and mark these out. I can either go to the course page or I can use the arrow to go to the next page. And again, every one of these donuts will have more information. So if I click on the ENT donut and I click on this more option down here, I have lots more options on the ears, etc. If I come down here where the throat is, I have this wonderful open mouth view of the teeth, and I can say this, all these teeth are missing, or there's a lot of dental decay or whatever. I absolutely love this. So that's that. Okay, click out to move on. So that's the exam course page. Nobody says that you have to go through a patient just in this linear fashion. So I could go to the history tab, I could mark a couple things, I could come to CPOE, I could put in some orders, and I could go see the next patient. Okay, it's just like putting that T-sheet off in the corner and I can go on to the next one. You don't lose anything. But let's talk a little bit about studies and things like that. For EKGs, if y'all are interpreting these EKGs and if you are billing for the EKGs, there are certain requirements. So click on the donut, do an interpretation time, and then start documenting. You know, rate and rhythm is required. Okay, so I'm going to say it's normal sinus, the rate's 88. You have to do a certain number. I believe it's 2 out of 3 of these. But really, any good EKG read, why would you say something about QRS and ST? So I'm just going to say they're normal. STs are normal. If they're abnormal, I can explain it here. If I do serial EKGs, I can do that here. If I do a comparison, I can do that here. Okay. Typically on X-rays and things like that, I don't know what your process is, but let's just assume that when you get an X-ray, you get a read back in a reasonable amount of time. So if I get a chest film, I might go in here and click that and say, you know what, no acute disease, and that was interpreted by the radiologist. I'm probably not going to put a lot of time into this if I have a read, which I can also pull into my note. But if, on the other hand, it's 3 o'clock in the morning, I'm not getting a read in a timely manner, I'm going to send this guy home, I might then say, you know what, I'm going to put a little bit more effort into this, and I'm going to say, I viewed it, I interpreted it, okay, and save that note. So that's the kind of 2 scenarios for that. There are multiple studies in here. You click on other studies, and you're going to see all kinds of fast scans, CTs, MRIs, etc. Okay, so just look at it and kind of get comfortable with it. Labs you don't have to do much with, because if those results come back in your note or they become available, just hit preview results. And when you do, it's going to show your CBC, your 6, whatever, and you're going to say apply to note. And it will be highlighted with abnormals, critical values, etc. You can then make some comments about it if you want to. Most people do that kind of thing in the progress notes where they kind of talk about their medical decision making and differential diagnosis. You can do that here, but I tend to see most people use the progress area. Find that little blue line, and you can go ahead and type to your heart's content. The other thing you might want to do is just always say, I ordered, reviewed, medical decision making. All this stuff is part of it. Procedure notes are here. So procedure notes will be top level depending on what flavor template you got. If I have a lower extremity injury, wound repair is going to be there, splinting is going to be there, things like that. But let's just run through a wound repair. There are multiple procedures inside this donut. If you want to see that, there are quite a bit. Okay. Big thing here to remember is, splinting versus fracture care. If I just put a splint on somebody, I'm going to go here. But if I'm doing something with a fracture, whether I reduce it or don't reduce it, I'm going to go with one of these two options, okay? But let's do it. Let's keep this simple, and let's just go to wound repair. I want to show you something. So location, let's say it's a scalp lac. Click out, and I'm going to say it's a 2.5 centimeter lac, and I'm going to click out, and I'm going to say, you know, subQ linear, it's clean, neurovascular is good. I used some 1% lidocaine, I prepped it, explored it, and I closed it with some fluoroproline. And I go to click out, and it stops me because I did not do complexity. I can still blow through this. It will come up again, but really, you know, why? Just pay attention to your feedback and say, oh, that was a simple suture closure, and I'm good to go. This generates a good code for this, okay? So a lot of these procedures will have some type of what we call dynamic feedback. All right, progress notes. Again, this is typically where I see people open this up and then start making comments about differential diagnoses, things like that. You can use these, but this is typically where I see it happen. There are also flavored progress notes, so just a general progress note, if you open that up, you know, I've got O2 going, their pain's better, vomiting's better, yada, yada, or I can go to a respiratory flavored, or I can just go to more of a reeval. And basically, I would just get in here and kind of look at this and get familiar with what is available. But I'm going to say, you know, they're better, there's no more vomiting. Etc. I have to apply any kind of note I put here. I have to hit apply, and that puts that note, applies that note to my note. Okay, and there it is right there. Let's talk about critical care time. Typically, it's grossly underutilized. There is a description of what qualifies for critical care time here. If you click on it, if you're good with it, just go ahead and circle it. Remember, it's time-based. So I'm going to say it's 40 minutes. It was direct patient care. I reassessed them. I reviewed records. I documented care in T-System. I talked to the family. I also looked at labs, x-rays, pulse ox, etc. So go ahead and document everything that was part of that. Coordination of care, as I discussed with, so click on the line and say I called the PCP at this time and date, and I can click out. And I can come back in later and say I called again and still have no answer, etc. Or finally the answer, they're going to see the patient in the ED. Okay, and I'm going to say that was now. All right. Ordered old records, etc. is here. Transfer of care. So if you transfer care over to another provider, you're just going to come in here and say case discussed. I can put down here Dr. Smith. And we are waiting on lab and x-ray. And get out of it. So here's the deal. If, let's just say it's an x-ray, it's an ankle, for example. I'm going home. I've completed the history, the exam, the appropriate course stuff. Dr. Smith is going to take that patient now. I've documented my transfer of care. I'm going to go ahead and lock my chart because I'm done with it. I'm not going to do a DX or DI because I don't know what the diagnosis is. So the point is, if I'm handing off, I'm going to stop at that point where I'm done, hand it off to the other physician and lock my chart. When the new physician comes in, they're going to come in and on the history, they'll probably say seen before, see previous note, whatever. There's no reason for the second doc to re-document everything that the first doc did. Okay, so just come in and do your thing, do your course, come up here and say the x-rays were negative, and we send them home with an ice pack and crutches or whatever. Okay. All right, disposition, you can come down here and you can select something. So if you discharge them home, just say I discharged them. You can say good condition, that's fine. Or you could say I admitted that patient. If you want to get in here to ICU, med-surg, etc., that's fine. You can do that. Or if I transfer that patient, we're just going to say discharged, good condition, home. Okay? AMA is here, eloped is here, medical MSE screening is here if you need that. So typical workflow, again, I'm going to work my way down here. I'm going to go over to DXDI. So this is where I'm going to select my diagnosis and my discharge instructions. So the workflow is a little bit different, possibly than what you're used to. So I'm going to come in and I'm going to say this patient's got GERD, and I'm going to immediately click on this blue exclamation because it's going to tell me what I need for a good ICD-10 code. Does this patient have esophagitis? No, they don't. Boom, green check mark, and these are my discharge instructions. And click out. It's that easy. I would just get in the habit of always doing that. Let's do something a little more complicated. Let's go with a fracture. So go to fracture, and again, I'm on a belly pain, so fracture is not top level. Let's go with an ankle fracture, and as soon as this opens, again, I'm going to click this. So you see now there are several things I need for a code. Laterality, is it right or left? It's right. Is it closed or open? It's closed, not displaced. And I'm going to pick up my instructions here, and I have a green check mark, okay? You want the green check mark because it means that you have a good ICD-10 code. There will be times, though, where if you do something like pneumonia and you click on this and you go, well, shit, I don't know. I don't know if it's viral, RSV, whatever. So, but you might know, is it a bronchopneumonia or lobar aspiration? So if you know that, you do that, and by golly, I got a check mark. Nothing says I can't do some other things. No, there's no respiratory failure. They're not septic, etc. So you can backslash things and so forth. But these are where your instructions are. All right. So this is diagnoses. Sometimes you might think outside the box. Might be COVID may not be under COVID. It might be under coronavirus. Certain items might be different. If you free text a diagnosis, it will not generate an ICD-10 code. So your coders will have to do that. All right. Prescriptions, I think we can ignore because I believe you are e-prescribing, and there will be an icon right here for e-prescription. You would click on that donut and follow the steps for e-prescribing there. Discharge instructions are anything in addition to what I would have already circled here with my diagnosis. So I think you're going to find that most of those that you circle here have a lot of information. I don't necessarily have to go here, but this is where my work release is. So I'm going to say this fellow is going to be off work for the next 2 days until cleared. Okay. This is your follow-up. So this follow-up with doctor right here, this will be populated by a list of your referral docs, which we have not been given yet, but that will have those doctors in there. You can filter by name, filter by specialty. You can do a search, etc. But that's where this will be. So we'll select your doctor, select them, and then when they're going to follow up, and you'd fill that out. This is your MIPS for hypertension screening. So if you're doing this, this is where that's located. Or you can just say follow up with your doctor in 2 days. Okay? All right. Don't have to worry about any of this other stuff. Nurses are doing that. Your next process move, though, will be once I've done my diagnosis, clinical impression, discharge instructions, prescriptions, etc., I'm going to move down here and I'm going to go and select print instructions and discharge. So you would click on this. I'm not going to do it because it'll print somewhere. It will print at a printer located near you. You will gather that up and put it somewhere in that little box wherever the code is for your system, or however you put stuff. And the next thing you're going to do is you're going to hit discharge. Now this is going to take you back to the home screen. Oh, my bad. I already moved them out. It's going to take you back to the home screen. It is this patient right here. And typically what you would do is you would go in here and select your discharge. You would select your preliminary disposition and your disposition time and click OK. And that's what flags it for the nurses. So once you've done that, make sure that those instructions you printed out are located somewhere for the nurse. Make sure that you've done your e-prescribing so that now the nurse sees this as if they're flagged that this patient's ready to go, and they're going to go in and discharge that patient, and you're not going to worry about it. When they discharge that patient, and let's just pretend I'm a nurse, when they discharge it, they're going to do this. They're going to click in there, and it will automatically check this box, and they're going to click OK. And what's going to happen is that patient, I have to do this because we've been playing with this patient for a while. When they let that patient go, and they're not going to see this physician feedback, I just want you to see what happens. That erases the patient off the board. It's kind of like the old grease board. They just erased the patient off the board. So you're going to go, where's that patient that I discharged and I need to finish the chart? Well, it is in your incompletes. And there she is. Okay. So let them pile up in your incomplete. We don't care about it. You know, just stay with the all patients, move the meat, get them in and out. And then when you have some downtime, come back to your incompletes and go, okay, so I need to finish Magnolia White's chart. What we definitely want you to do is we want you to lock all your charts before you leave at the end of your shift. So you're either going to be done with that patient or you would have transferred care on that patient. Regardless, you're still going to lock that chart, okay? So what you're going to do, you're going to look at this, and the easiest thing to do is come down here and hit your feedback. You have very few hard stops, but it's just going to give you an idea of where you documented to. You didn't do family history, but that's fine. It's an overridable thing. You can click OK. The other thing you can do, you can skip the feedback, or you can just say, you know what, I know I've documented everything on here. Or you can go through and actually look at each section of that template and just make sure you've documented. But at some point, you're going to do this. You're going to click on Lock. Lock's going to show you feedback. You're going to say Override Manager because this is overrideable and this is customizable. So let your folks know. But we're just going to override it, and we're going to say we're going to override family history, and the reason we're going to override it is it's appropriate for level of care, and we're going to click OK. And then we're going to hit Lock. And this is not anything you're ever going to see because we put these patients in manually. So I don't have a PIN number, but you have a 4 or 5 digit PIN number. You would put your PIN number. This is pre-checked. So when you lock your chart, you sign the order sheet. Okay? And you would hit Lock. When you hit Lock, that patient is now out of your incompletes, and that patient will move to the history log. So once I lock that chart, that patient is going to be only visible in the history log. Okay, so again, look at the all patients, select your patient based on triage level, length of stay, how long they've been here. Select your patient, whoever you're going to choose. Click on history. That's going to open the template picker. Select your template. When that template opens, select a time seen, and then go ahead and document each thing. Again, I can fast track this patient. I can say, I can look at this loose tooth, loose or lose. I can highlight and click on the history log, select a template. I can then come down to CPOE and put in orders and do that. So let's talk about CPOE. This is the last part of it. CPOE opens. Somebody's already put some orders in. The nurse has put some orders in. But let's say I want to add some orders. So I can go to order sets, and these are being built right now. But for example, chest pain order set contains all these items. If I hit pre-select, it should pre-select what my facility agrees on is a chest pain protocol. So you're not going to have Dr. Smith's chest pain order set and Dr. Brown's order set and everything like that. But there's nothing that's saying that we can include all these orders that you want. But let's all agree on what pre-select is. So I can also come in and say, you know what, I don't want a D-dimer on this one, but I do want a lipase and an amylase. Okay, so you can hunt and peck and change however you want, just so you know. Any orders that have exclamation marks are things that have to be addressed. Okay, so if you think about a chest replacement, that's going to be a reason for the study. Okay, click OK. That goes away. Monitor. Apparently, they want to know what kind, so we're just going to say continuous. Click OK. O2 is obviously going to be asking for a flow rate and a method of delivery. And we'll click OK. So if I had IVs in here, An IV would have exclamation marks because it's going to ask for a flow rate, etc. Do you want a bolus or not? So let's just find an IV. I don't see any here. So here's what else you can do. You can go to orders A to Z. You can type in IV. And you notice nothing pops up, and the reason is because I'm on the lab tab. So if I go to meds, all of a sudden now I've got some options. So let's just go with D5W since there's no saline. I'm going to click on this. Now, if I want a bolus, that's this section here. So like I said, I want a bolus of 1,000, and then after that, I want you to run it at a keep open rate, okay? Or I want you to run it at 125 after that bolus. If you want to add mag, thiamine, etc., those options are here. Okay, so we're going to say this. We're going to order now times 1. We're going to make that order, and we're going to process that order and place orders. So it's actually a couple steps faster for you to do the orders than the nurse, because they have to assign a physician and they have to say what kind of order type it was. But this is what it looks like. And when you get out of that and you click, you'll notice that there are now some new orders have been placed. So this is another way you can keep track of, are the nurses on top of the orders. If you look up here 20 minutes later, these are still red. Nobody knows about it. Might be a good time to say, hey, what's going on with that gal in the waiting room with the loose tooth? Okay. All right, we're at 31 minutes, 31 seconds. I tried to make this a real quick thing, and that is the overview. I would encourage you to look at LMS and watch videos. If you have any questions, help is up here. Click on that. There are several help topics that you can look at, user help, and that breaks it down into physician, providers. You can look at provider, and then there are all kinds of things here to help you do it. Okay? And that's it. Short, sweet, meat and potatoes version. Thanks.